So, hello and namaste. This is Dr. Gaurang here, and I want to talk to you today about a very important clinical condition, which is very important in today's times, and also something that homeopathy has a very good scope on. We are talking today about osteoporosis and osteopenia, and this is something which is so very uh, common, especially around the menopause, post-menopause, after a particular age. And homeopathy has some very good approaches in these cases. And I'm going to talk to you about how homeopathy can support. Of course, we need to look at certain kind of supplements. Of course, we also need to look at certain food substances which have high vitamin D, calcium, etc. But along with that, how homeopathy can help in the healing process, in the healing journey. So I want to talk to you a little bit about what are the commonest remedies I use in my practice. The commonest remedies I'm using in my practice are sarcodes. This is so important. Sarcodes are remedies prepared from healthy living tissues. For example, thyroidinum, insulinum. Right? These are all sarcodes. But the sarcode that I use the most often in cases of osteoporosis and osteopenia is the remedy prepared from parathyroid hormone, which are these small kind of glands that you can see. This is a remedy I use a lot, and I use it in 6 potency, and I could use it quite frequently. The other remedy that I use very often, of course, is thyroidinum itself, especially in obese women who's putting on a lot of weight with this early osteoporosis, who has a craving for sweet, who also has a feeling of being persecuted, and who's either very slow paced like Calcarea carbonicum or fast paced. In some cases, there is a steroid-based osteopathy, which means that there can be certain situation where the patient has taken steroids for a long time and then has developed osteopenia, osteoporosis. Here, I often use a tautopathic technique where we use a remedy, hormone remedy, cortisone in potentized dose. Similarly, when all these sarcodes fail, the remedy of choice often for me is anterior pituitary. I've written a whole book on sarcodes. At some point, you can go through it. Of course, indicated remedy would be very important, including Thuja, which is so important, including Calcarea salts, which are very important. I want to specially talk to you about Schussler tissue salt. The 2 Schussler tissue salt which I use is Calcarea Phos 12x and 6x Calcarea flur. And of course, I also use one more tissue salt, is 5-phos in 6x. So this is something. And in the World Osteoporosis Day, that is today, I want to talk to you about the importance of homeopathy in this journey. I also want to invite you to our new course starting in 6th December. That is a 30 hours online weekend course which goes on for 2 years, access, and where I've invited the best homeopaths in the world talking about musculoskeletal disorder. We will be talking so much about cases of osteoporosis, osteoarthritis, osteopenia, menopausal issues, autoimmune disorders. And all of us are going to come together to talk about this, including my teachers, Dr. Gajanan, Dr. Borkar, Dr. Rasal, Dr. Jonathan Hardy, and so on. So I hope to have you part of this course. If you're watching this, you have a 25% discount on the seat. There are few seats remaining for the discount, and I hope that you are able to join soon. The discount is for the last 2 weeks, actually last 10 days. This is the email ID gauranghg@gmail.com. I look forward to have you with us. Thank you and namaste.